not might be from the anterior part, but from the posterior part of posterior 1/3 of your tongue. It is not important to know right now. Okay, so I was discussing over here regarding this motor nerve, है ना? ये motor nerve का नाम क्या है? What is this? Facial. It is coming from facial nerve proper nucleus, है ना? What is the function of this? I'm just briefing up the things now. I'm not going into details. Okay, so what is the function of this is that this is the motor nerve which supplies to the muscles of your facial expression. Okay, this supplies to muscles of facial expression, supplies to muscles of your facial expression. Okay, and the next important thing, pink one. What is this pink one? This is your superior salivatory nucleus. और यहाँ से जो motor fibers are, what motor fibers you call it as? Parasympathetic motor fibers. I already told you, right? Now what will this do? This does the parasympathetic function. Parasympathetic मतलब कौन सा function हो सकता है guys? There are two important functions over here. एक हो गया, one is lacrimation, tears, and the other one is your salivation. So what are the two important things? One is your lacrimation and the other one is your salivation. Now how do these fibers innervate? How do these fibers they branch? How do these fibers pass, and finally they cause lacrimation, salivation, and cause contraction of, I mean, the muscles of facial? How do they innervate the muscles of facial expression, and how are the taste sensations carrying out? Everything we will discuss in detail step by step. So this is the basis for what I'm going to teach you right now. Okay, so the next important thing which I wanted to tell you is this one. Now once you are clear with this, now let us dive into the topic. Now, as you can see here, let me first draw the anatomy. Okay, so let me just write down the parts over here so that you'll understand. Just have a bird view of this before I write down all the parts. These are all the parts. Okay, so now let me zoom into this. All of you know this is orbit. I'm not writing it. Okay, but this one over here is your lacrimal gland. What is this? This is your lacrimal gland, and I also want you to take a screenshot at the end. Okay, and here we have got anterior cranial fossa, और ये हो गया middle cranial fossa, और ये हो गया posterior cranial fossa. Clear? Now within this, what is this bone over here? This is your maxilla. Okay, this is your maxilla, and all of you know behind the maxilla here you have got a plate. Guys, tell me, what is this plate? This plate is called as your pterygoid plate. This is called as your pterygoid plate. ठीक है, और ये मैक्सिला और टेरिगॉइड प्लेट के बीच में ये देखो, ये मैक्सिला हो गया एंड दिस इज टेरिगॉइड प्लेट. So between the maxilla and pterygoid plate, this space whatever you can see over here, this is called as pterygopalatine fossa. Okay, so what is this particular area called as? This one is called as pterygopalatine fossa. So this is your pterygopalatine fossa over here. Now after this guys, what are these three openings over here? These are three foramens. Okay, so here you have got foramen lacerum. ऐसे याद रखो, this is L shape. So foramen lacerum, this is foramen rotundum, and this is foramen ovale. So let me write it down. This is your foramen lacerum, foramen rotundum, foramen ovale. ठीक है, बस यहाँ तक याद रखो. ठीक है, now let us go back here. When you go back, look at this. What is this part? This one over here is your middle ear. All of you know, है ना? This is your middle ear. और ये वाला कौन? ये वाला part. What is this part over here? Yeah, what is this part? This is your internal. This is your internal acoustic canal, right? This is your internal acoustic canal. And if you look here, this green shade, whatever I have done, this is, what is this? This is your anterior wall. ये वाला जो green shade है ना, this is your anterior wall of your middle ear. और ये वाला जो shade है ना, this is your posterior wall of the middle ear. Okay, और नीचे जो yellow color है ना, this is your floor. Roof निकाल दिया मैंने, and this white color one is your medial wall. ठीक है। और यहाँ पे जो लैटरल वॉल होना था, आई हैव रिमूव दैट लैटरल वॉल ऑल्सो।